So I'm really glad here today to be introducing Ankush Bansal. He's also from the Miami area. He's an internal and lifestyle medicine certified physician. And when he finishes here, he's going to COP29. He's leaving from here to go to COP29. So I really thank him for making time to come in, and another really engaging guy. He has a lot of great things to say, and you'll hear a lot on the public policy side. So Ankush.
Thanks so much, Bob. Can we, son? Great. So Bob, I agree. I don't like the word climate change. In fact, many of us around the world, we actually use the term climate crisis, because that's really what it is. And you had mentioned that I'm going to COP29. It'll be my 4th COP in a row. We've got a very robust health community there at the COP meetings. And what we say is the climate crisis is a health crisis. And last year at COP, I actually had the privilege of hearing a very, very profound quote from David Boyd, who's the United Nations Rapporteur on Environment, Health, and Children. And he said the climate crisis is a human rights crisis. So what I would say is the climate crisis is both a health crisis and a human rights crisis. On education, Karen will enjoy this, but you know, Dr. Fu was talking about how we're not taught about climate change, even to this day in medical schools. There are a few medical schools around the country. Harvard is a prime example, where they do integrate climate change into the curriculum, but it's few and far between. And the only reason it happened is because the students demanded it, including sometimes through collective action. And that's how they got that there. However, the beginning of this year, the University of California, San Diego was the first university in the country to require climate change training of all the undergraduates. It doesn't matter what your degree is, what your major is, you will learn it before you can graduate. It's now a requirement there. It's interesting because a lot of other countries actually do include climate change training in their medical school curriculum. And you'll never guess which country is right now ranked top in the world on integrating climate change in medical education. Any guesses? Nope. Nope. It's, I'll give you a hint, it's in the African continent. It's Rwanda. Rwanda, and they only have one medical school in the country. And they have the most robust climate change education. So as Bob mentioned, I am a physician. You can see my titles up there. I actually live in West Palm Beach. In 2008, no, 19, no, 18, I think it was 18, we got hit by Hurricane Irma. It actually damaged a significant portion of my roof such that the whole roof had to get repaired, and it took over 2 years of litigation with the insurance company and then the roofer to finally get it fixed. Hurricane Milton, which you all felt the brunt of, on the East Coast, we got hit by tornadoes. My neighborhood was actually flanked by tornadoes on both sides. And if you recall, there was an EF3 tornado that hit a new community in Palm Beach Gardens. It just so happened that that was the community that was right across from where I used to live 2 years ago. And one of the houses there that was damaged, the owners had moved in to this brand new house just 6 weeks prior. And now their house is damaged. And I think that's the one where you see the pictures of the dumpster on the roof. So yeah, so this kind of thing, unfortunately, is happening more frequently. So what I'm going to talk about is, you know, in the face of climate change, particularly heat and extreme storms in Florida, what can cities, counties, and communities do to mitigate the effects of excess heat and adopt preemptive planning in the communities? So you heard from Dr. Fu about the medical part. I'm going to talk more about what can be done from outside the hospital and outside the clinic. So why does this matter? So, you know, climate change affects health by 4 broad ways. You see it on the left-hand figure. There's direct impact, spread of disease, disrupting the food supply, and disrupting well-being. Florida Clinicians for Climate Action, which I helped co-found, and Dr. Fu is also a member of. We developed this acronym called HEATWAVE, which is very apropos for Florida, to summarize the specific heat health effects. I'm only going to be talking about heat illness, not the other ones, but just keep in mind that all of these health effects are interrelated, and I'll give you an example of a very recent example in this area later in the talk. Again, why does it matter? This is another visualization of the health effects from climate change. I'll focus on the area around 10 o'clock on this chart, which is the heat effects. So I'm just going to go briefly on heat stroke because Dr. Fu did a great job. There's two things that I want to add on. Number one, when you get to heat stroke, you do not sweat anymore. Your body has given up. It cannot sweat. You will sweat with heat cramps and heat exhaustion. You will not sweat with heat stroke. And that's when the body temperature rises around 104 degrees. That's when you stop sweating. And that is an emergency, as Dr. Fu mentioned. So I'm going to talk about 7 strategies that can be used at the governmental or community level. And the reason I picked these 7 strategies is this is what I found in the literature, both in the scientific literature and the policy literature. And the other important piece of this is these target particularly vulnerable populations. So that's the young, the elderly, disabled, those working outside because that's their only means of income, as well as those, and I'll mention this again, those in prisons, detention centers, and jails. So the first is heat health warning systems. So let me back up. Dr. Fu mentioned the heat index. So there are 2 ways to measure the effects of heat on your body. The heat index is what we see all the time. That's what you see when you watch the news or go on your weather app. The problem with the heat index is that's what your body feels in the shade. So it's affected by humidity, and that's why the heat index is higher than the temperature. But that's what you feel in the shade. Most athletes and most people working outside are not working in the shade. They're working in the sun. So it is much, much hotter. That's a more complicated formula than what Dr. Fu showed you for heat index, but this is called the wet bulb globe temperature. And this is what the body feels in the sun. So it takes into account not just humidity and the temperature, which is what the heat index does, but also the intensity of the sunlight and the wind speeds. So now, moving on to heat health warning systems. What are they? So a heat early warning system uses weather and climate forecasts to help people prepare for and reduce the health effects of extreme heat. There's some government tools that I'm going to show you at the very end, and I think you get a copy of the slides that you can use, and those are great. The problem with those tools is that they're at the national level and they go down somewhat to the community level, but we don't have tools that go down to like the street level or the neighborhood level. And that's one of the things that we need more research on. So a good research, and I think Dr. Fu had mentioned this, is heat.gov. There's a lot of resources on there. But the heat early warning system then leads to a heat health action plan that includes the warning systems for both policies and strategies to reduce the health effects of extreme heat at any governmental level. So that's local, that's your HOA, that's the county, the state, the city, as well as nationally. Miami-Dade, for example, has an extreme heat action plan, and that was developed by the chief heat officer of Miami-Dade, which, by the way, was the first chief heat officer of any city in the entire world. So Miami-Dade was the first on that. And we can establish these early warning systems to predict heat waves and issue public alerts, especially for those most at risk. But we also need public education campaigns, especially for vulnerable populations, on what the signs of heat illness are and how to respond. So that requires partnerships of all these governments, but you also need efficient, streamlined, and robust assistance with things that you might need during hot days. That would be things like air conditioning, as we just saw, water, and shelter. And then don't forget people that have substance or alcohol use disorders, because oftentimes they don't even realize the signs because of the intoxication or the effects of the substances they're using. And also utilize pharmacies, because there are some medicines, particularly psychiatric medicines, but there are some neurologic medicines as well, that will increase your core body temperature. So what you or me may feel heat exhaustion, let's say at 103 degrees, they may actually feel it at 99 degrees because their body temperature is already increased because of the side effects of those medicines. So I put this picture up. You can see on the right, this shows one of the hottest days in a populated area in the last couple of years. No means the hottest. It's been hotter in some cities this year. So this was Dubai, July 17, 2024. The heat index was 144 degrees Fahrenheit. So the other part of why that's important is humans are in extreme danger when the heat index gets to above 122 degrees. The other piece of this is air quality. So you also see the forecast for air quality every day, especially on hot days. Does anybody know what number the air quality index is when you start feeling health effects? Any guesses? So around 300 is the upper limit of what's healthy. Lahore, Pakistan, a few weeks ago, hit an air quality index of 700. So the next thing I want to talk about is urban planning. So cities and counties can increase green spaces, promote reflective surfaces, and redesign ventilation. So this means incentivizing building of green roofs, developing parks in an equitable way. And this is important because a lot of cities are building parks, but they're building it in certain parts of the city so everybody can't use it, especially those most vulnerable. So you have to consider in an equitable way so that everybody is able to access it and use it. And then also you might want to consider community gardens because you can use that for food, for community, as well as further heat reduction. Reflective surfaces, so for example on roofs. So you may see some roofs that are like white on the top. That is because it's reflective. That scientific term is called the albedo. You want to increase the reflectivity because it's going to reflect the heat back up into space and not cause more heat trapping, causing that heat island effect. You can also redesign ventilation, which promotes airflow, reducing heat trapping, and reduces the use of air conditioning. And why do we want to reduce the use of air conditioning? Yep, because it blows off heat, but how do you power the air conditioning? With the fossil fuels causing the heat, right? So you want to try to reduce the use of air conditioning. And there's excellent examples from cultures all over the world, going all the way back to ancient Greece. And this is a picture of one of them on the right. That happens to be in the Middle East. But the middle picture kind of shows what the schematic of this is. And so you get hot air that comes in. There's cold air at the bottom. It kind of pushes the hot air out. And so you get cooler air inside. So it can help a little bit with the ventilation as well as the heat trapping. And so then you need less air conditioning, which then reduces the use of greenhouse gas emissions and increased temperatures. Again, don't forget about prisons, jails, detention centers, and also schools, because there's a lot of schools, especially older built schools, that don't have adequate ventilation and air conditioning. And so you're having kids having to go to school in this extreme heat. They're not very conducive to learning, much less their health. Also require new housing or upgrades be heat resilient through weatherization, ventilation efficiency, shade, and roof design. So one of the things that you may have heard is about public cooling centers. And this seems to be a very popular topic because intuitively it makes sense. They've been offered as a solution, but they don't really work for places with long stretches of days with temperatures above 100 degrees, like Florida and Arizona. So I think Bob had mentioned in his initial talk about Chicago. So back in 1995, Chicago hit a heat index of 125 degrees for 5 days. 700 people died. They had cooling centers, but the problem was, and it's the same problem that exists now 30 years later, is that they didn't know about them or because they were too far away, especially for those with mobility, medical, financial, or transportation issues. Same thing happened this year in New York City and Washington, D.C. with the high heat days. Same is true in places like Japan and India. The Southeast has 1,400 cooling centers, but a 2023 study showed that only 36% of the population and less than 10% of vulnerable populations are within 15 minutes of a cooling center. So they're not really serving any purpose. However, cooling centers have been shown to reduce severe heat illness in the most vulnerable populations, but not so much in the general population. So maybe we can build these cooling centers or retrofit existing buildings to serve those populations, the vulnerable populations. Also remember the resource allocation, fans, water, medical supplies. Need to make sure those are there. Transportation logistics, like rideshare or public transport, could also be considered for those vulnerable populations. But the best approach, I think, is prevention. So that really comes from urban planning and heat-resilient built environments. So clinician training. It was mentioned earlier that we need specific education of physicians, nurses, pharmacists, and EMTs on heat illness, especially here in Florida. I'm not going to belabor that point, but as Dr. Fu mentioned, we do this for heart disease and breast cancer and colon cancer in terms of community efforts to raise awareness. Why don't we do it for heat illness? We should do it for that too. Health systems need to integrate climate hazards such as heat into existing disaster management plans and for all climate-related health hazards. So here's the example that's recent, Hurricane Helene in Milton. So just take, for example, the hurricane, it comes in, causes a power outage, so you lose AC during the heat wave, worsening air pollution because all the trucks, and then everybody has their petroleum-based generators, causing more air pollution. The water gets contaminated from flooding, and then you get soil erosion resulting in an infectious disease outbreak. But wait, that actually happened with Milton. There was a dengue outbreak just a week or two ago because of that, because of all the standing water and all the mosquitoes. So this does happen even today. So disaster medicine training right now only requires 3 days of supplies on hand. That's what the curriculum says. So I ask you, is that sufficient? Do you think 3 days of supplies is going to work for us here in Florida? Think about the last few years of hurricanes. Probably not. Clinicians also need to advocate for implementation of climate resilient health systems. And I'll give you an example. So I just came back from the American Medical Association meeting in Orlando 2 days ago. One of the issues that we talked about was an effect of Hurricane Helene in Milton. So let me back up. Hurricane Maria, when it hit Puerto Rico, there was a national IV fluid shortage. And the reason was because of, like most things, we decide to put all our eggs into one basket and have one or two companies make all of our critical supplies. So almost all our IV fluid was being made by Baxter Corporation in Puerto Rico. That got destroyed. There was a national IV fluid shortage. Hospitals didn't have IV fluids. Elective surgeries had to be canceled nationwide. So they moved it to guess where? Asheville, North Carolina. And it happened this year. And then Milton came in, and the second biggest producer of IV fluids in this country is a factory in Daytona Beach, which also got hit by Milton. So currently, it's ongoing for the last few weeks, there is a national IV fluid shortage. So I cannot order IV fluids for patients unless it's an absolute emergency. And a lot of hospitals have canceled elective surgeries because there's not IV fluids. This is going all the way up to the president and HHS, but the government hasn't learned their lesson before. They're probably not going to learn their lesson this time about not putting all your eggs in one basket. As another aside, the global healthcare sector contributes 4.8% of global greenhouse gas emissions. In the US, the healthcare sector contributes 8.5% of all of our US global greenhouse gas emissions. So if you quantify that, just the US healthcare sector puts out more greenhouse gas emissions than everything out of the United Kingdom. That's how much greenhouse gas emissions we put out in our healthcare sector in the country just because we're so big and because we need to do everything all the time. So community outreach. Cities and counties can facilitate education on prevention at home, in the community, in the workplace, and for those working outdoors. Communities can also provide important granular data on vulnerable populations so that resources such as fans and water can be arranged. So again, the national resources, they don't get granular enough down to the neighborhood level. This is what communities can do. And I think volunteers can be used to check on at-risk individuals, particularly on high heat days. So we do the same thing, for example, Meals on Wheels, or people who are stuck at home, disabled people, people with psychiatric conditions. We can do it for the same thing for at-risk people for high heat days. So again, elderly, chronically ill, those with mobility issues, the unhoused, veterans, children, and then those with limited financial means. And then the big thing, I think, and if you recognize this as the Florida Senate, is policy and legislation. So I talked about building codes, about retrofitting for making it more efficient. In the workplace, what I would say is, and this happened in session this year, and I actually testified in front of the Senate on this, is they passed a preemption law, and it was signed by the governor, that said that if local governments want to mandate stronger heat standards for employers towards their workers, that is now illegal. It has to be by the state. And the state's requirements are much, much less stringent. So what I would say is we need to reverse that preemption law at the state level so that counties who know best, because what happens here in Sarasota County is different than what happens in Duval County, right? They have different climate. To allow counties and cities to mandate water breaks, access to water, and access to shaded areas with ventilation and cooling for outdoor workers and athletes. And that does result in significant results. OSHA and CDC regulations aren't strong enough. There's currently a comment period with OSHA until I think mid-December on those heat standards. So if you're interested, you can go onto the OSHA website and put a public comment about that. And the state of Florida regulations, as I said before, are inadequate. And David, you're gonna like this. So I just happened yesterday to find a paper that was published 2 weeks ago by former Senator Bill Frist, a cardiac surgeon, and Vanessa Carey, daughter of John Carey, and herself, an intensive care physician. And they summarized research that addresses heat protection for workers, but it's good for business. So they said 2.5% of worker productivity drops for each degree rise in temperature above 80 degrees Fahrenheit. And that costs the US $100 billion annually, and that'll double by 2030. And so when they looked at, if it's been done before, they looked at heat protection measures at a sugar plantation in Nicaragua. There was a 72% reduction in injuries, 94% decrease in hospitalizations, and 20% increase in productivity. But we could expect better results in the US because 62% of Americans who have employer-based health insurance have at least one chronic condition. But only 17% of America's CEOs have put any resources towards climate protection for their employees. For athletes, there's 2 interventions that have been most studied. Wet bulb globe temperature, which I mentioned before, is how hot the body feels in the sun. So school districts actually set these policies. So check with your local school district to see if they have a policy for their athletes that practice and play outside. And some universities are now starting to implement them. Heat illness needs to be integrated into disaster preparedness plans. And lastly, the city and the county can't put climate sustainability as a key factor in future planning and regulation. Or they need to put it so that we don't exacerbate the heat issue. So public transport, green spaces, tree cover, walkability, bikeability, and they can work with and advocate to state and federal lawmakers on regulation enforcement and assistance. So finally, I'm going to talk about research and development. So just briefly on R&D, mitigation of the cause of heat-related risk, that's what we got to do, fossil fuels. So everything I talked about is adaptation. None of that will work if we don't address the cause. That's why mitigation must be paramount for any climate health-related risk. We can't expect to keep mopping up the floor if we don't address the root cause and shut off the tap. And let me just be clear on this. Climate change is not an existential threat to the Earth. It is to us and other species, but not to the Earth. The Earth will be just fine. We will not. There are pilot programs on heat warning systems, action plans, and urban planning, community outreach, and policy programs. We need more of those. But having said that, there's already so much data, ideas, and pilot projects and policy proposals. We just gotta do something at this point. We've got to actually put that into action. So here are some of the government resources that I mentioned throughout my talk, and some of the references. And thank you.